I feel extremely humbled to have been invited to talk to you, and let me commend the previous speakers who have spoken very eloquently on their areas and expertise. And I will only add a few words to them. But let me say that today, as I speak to you, we are still governed by some international instruments that try to, of course, preserve life and guarantee access to some basic essentials to keep our lives going. Importantly, we talk about the Constitution of the World Health Organization, which in its preamble, indeed the second provision of its preamble, says that the enjoyment of the highest attainable standard of health is a fundamental right of citizens across the world. And this is without distinction to race, political affiliation, religion, tribe, or other contradictory provisions. Again, we all know that the 1948 Universal Declaration of Human Rights document clearly states that the right to life is a fundamental right of every citizen. And so it behoves all of us as citizens to engage those that superintend over our lives to guarantee these fundamental rights. You cannot have right to life without right to health and access to quality health care. But unfortunately, as I speak to you today, the world is highly challenged. Global health is imperiled. Global health is confronted by lots of challenges, just like our global existence is challenged. And this is not made any better by the ongoing wars and conflicts across the world. The issue of emerging and re-emerging disease conditions, we just are still recovering from the COVID-19 pandemic. Of course, the scourge of antimicrobial resistance, and of course, the climate change crisis. All of these have worsened health indices across the world. And so we need people who stand out, people who are altruistic, people who are committed to these values enshrined in the Constitution of the World Health Organization and the Universal Declaration of Human Rights, to advocate for a cessation of some of these contradictory scenarios that imperil the right to health and the right to life of all citizens across the world. The global health disparities are staggering. But unfortunately, we come from Africa. I come from Nigeria. These disparities are worse in Africa, and they are worse even in other countries like Nigeria. As I speak to you today, Africa has over 25% of the global disease burden worldwide. But we have less than 3% of the global health workforce. And this is worsened now by the whole phenomenon of the Jackpot syndrome. So, we all have a duty to commit to the restoration of the rights of citizens anywhere in the world, more so to guarantee access to quality health care for citizens. Access to care in Nigeria, like you know, is still very pitiable. A lot of people are still spending out of their pockets and indulging in what is called catastrophic health expenditures. How do we redress all of these? It is by emplacing and calling on board votaries of change, people who stand out. And that essentially has characterized my journey in the last 3 decades. I, together with others, I have tried my best to see how we can confront these inanities, these challenges, so that we all can live better lives and, of course, leave the world a better place for all of us. There are people who today cannot even afford to buy their drugs. Unfortunately, most of our governments pay lip service to the health and the health rights of their people. We all cannot abandon the people to their fate. And so we need people who stand out. I have struggled in the last 30 years, and more than that, to see how some of these issues can be addressed at the local, national, and international levels. But I also recognize that unless and until you are in a position to address this from a leadership perspective, you may not be able to achieve much. And that informed my leadership journey through the medical profession. Indeed, I thank God for His grace, because as I speak to you here today, I am the only Nigerian that has ever occupied the seat of president of the World Medical Association. I am the only Nigerian physician that has ever occupied the seat of the president of the Commonwealth Medical Association. The question you ask yourself is that, were there no people before you? Certainly they were. But what was the problem? That it took us 74 years before a Nigerian emerged as president of the World Medical Association. And that caused to question the issue of standing out. What really does it mean to stand out? I am not here to give you several definitions, but I'm here to talk to you from my own experiences. When you say stand out, what it simply means is that show distinction. You have to be distinctive in whatever you do. That is the only way you can stand out. Performing distinctively or achieving uncommon and extraordinary feats that marvel everyone and makes you to be recognized and appreciated. That is what it means to stand out. So in whatever endeavor you undertake, you can stand out. Standing out does not mean you have to travel to America, or you have to travel to the United Kingdom, or you have to travel out of your country. You can stand out from anywhere in the world. So that level of self-awareness creation is fundamental. Otherwise, you are going to be moving in the air, and you not know what is hitting you from left, right, and center. The moment you understand who you are and what you represent in this life, then you can begin to create a vision and a mission and strategic pathways to the realization of your dreams. I recognized early on that to change the world or to change systems, you have to be in a vantage position. Importantly, in some leadership positions within your organizational realm, to be able to impact on the existence of those systems. And so I struggled from the very beginning, and I got through first as president of the University of Benin Medical Student Association, where I exhibited distinction according to the report card of the members. And I went on to become chairman of the state branch of the Nigerian Medical Association. And today, the doctor's house you see there, I was pivotal to commencing the project. After 18 years of existence of the association in Edo State, and it has become now a reference point. But I left there and went national, because I thought that we all were living within a national realm. And as much as I want to do at the state level, if you do not get to that national leadership, it will be difficult for you. But again, I came at a time when people felt I was a very young boy, and that I was only to be seen and not heard. But I changed that narrative. How did I change it? By being of value to the system, bringing forth value additions. So if you want to stand out, what value are you bringing to the table? And so you heard that for the first time, a very young Nigerian physician became the head of all doctors in Nigeria in 2012. And to date, I remain the youngest ever president of the Nigerian Medical Association. But beyond that, I thought that having done it at the national level, you need to do it at the international level. Every day you go to meetings. In the last 15 years, I was attending international meetings. I did not see any black-skinned personality on the table. We were out of the room. And you cannot influence change if you are not in the room. How would that be possible? People Did they try the past and fail? If they failed, what happened? But I carried on, mobilizing my personal resources and not waiting for people to be part of a lamentation choir. Today, the story has changed. But to change that story did not come easy. I had to take on another requirement needed to stand out. And that is the requirement of courage, the requirement of determination, never giving up on your dreams, the spirit of never giving up. Because in my journey to the top, I faced a lot of barriers, what has been described as beyond the obvious. But I was determined to overcome them. Even if you fail, and I failed several times, because I tried 4 times to become president of the World Medical Association. In Durban, in South Africa, in 2014, I tried. It did not work out. In 2016, in Taipei, Taiwan, I tried. It did not work out. In 2018, in Iceland, I tried, and it did not work out. But I knew why it was not working out. Because sometimes you are said to be the best orator at the delivery sessions of the General Assembly. But what happened? But I did not give up on my dream. And today, Nigeria has been put on the map of the World Medical Association by virtue of that courageous disposition. So you must, if you want to stand out, have these requirements. What is your purpose? What is your passion? What are your strategic objectives in terms of your mission and your vision? How have you been able to recruit resources to help you to achieve your dreams? So you must empower yourself, not only financially, but with other resources. How do you dynamically appraise yourself? Because it's a journey. It's a process and not a destination. People will eventually see you and recognize the worth that you are made of. When I emerged, eventually, people knew that this was somebody who can no longer be put down. It was unputdownable. So, in all of this also, you must have character. People must know you for who you are. I talked to you earlier on about self-awareness creation, asking yourself, who am I? What do I really represent? People must know what you stand for. What level of integrity do you have? Do you say one thing and do another thing, like we have commonly these days? So you must have those character traits, those values, discipline, honesty, integrity, not involving yourself in fraudulent activities. And that is why when I served as president of the World Medical Association, recognizing I was the first Nigerian to ever be so granted that opportunity in 74 years, since the organization was created in 1947. I made sure I served with distinction, and I stood out as president of the World Medical Association. So, if you want to stand out, it is not about titles. It is not about positions. It's about committing yourself to excellence, committing yourself to hard work, committing yourself to your dreams, and committing yourself to ensuring that you contribute to the upliftment of your system and your society. And above all, you must commit yourself to legacies, because it's not about you, it's about the system. And that is why I thought it necessary that I must work with other votaries of change to set up a foundation known as the Dr. Osahon Enabulele Foundation. I could easily have remained in the World Health Organization and jumped on several vacancies that came my way. But I decided to return back to Nigeria. And people ask me, why did you do that? I said, no, I started from Nigeria. I will continue in Nigeria, and I will finish in Nigeria. So as I round up, let me say that mine has been a journey of commitment, a journey in committing myself to the strengthening of systems, importantly the healthcare systems across the world, believing that the right to life cannot be guaranteed without right to quality health care. And let me end by saying that if you want to stand out, you must remember the very words of Alvin Toffler when he stated, and I quote, that the illiterates of the 21st century will not be those who cannot read or write, but those who refuse to learn, unlearn, and relearn. And in my own words that I crafted as far back as 2012, if you want to stand out, you must leave your comfort zone and commit yourself to excellence and legacies. Because the opportunity for you to make impact and impact lives can never be recovered once lost. Let us commit ourselves to legacies. Let us commit ourselves to values. Let us commit ourselves to upliftment of humanity and see the rest as all being lifted out and all standing out for progress and continuous existence of humanity.